Why and how to avoid the consequences of untreated hearing loss? Now, what are the consequences of untreated hearing loss according to the WHO World Report on Hearing? Communication problems, social isolation, loneliness, depression, employment problems and burnout, psychosocial and cognitive health issues, lowering of the quality of life, and last but not least, the higher prevalence of dementia. Now let's start with communication. In a very late, recently published article in Ear and Hearing, the association between hearing loss and surgical complications in older adults is discussed. The conclusions of this article is that for every 10 dB increase in hearing loss, you will get a 14% increase in the odds of developing a post-operative complication. You can imagine that communication before surgery is essential. It's very important that the patient is aware of what is going to happen and can explain the details to the surgeon. Unfortunately, if you have untreated hearing loss, this may become quite complicated and lead to complications. By the way, this is also the case for people using hearing aids and cochlear implants. If they are removed too early in the process, so before the patient had the chance to discuss all the options and give good information to the surgeon, you may also have this kind of communication problems which should not arise. Another topic is unaddressed hearing loss and employment. Shan and others published in the Journal of Laryngology and Otology the following article, and they conclude that the highest quality studies currently available indicate that adult onset hearing loss is associated with unemployment. It is also referred to in the World Report on Hearing. Hansen looked at the Swedish population, a very large sample, and there they saw there was a statistically significant difference in prevalence of hearing problems between those people with higher burnout scores and lower scores. Here you see the levels of burnout scores. And this is in fact, the blue is indicating that they have either tinnitus or hearing complaints, or in red, both tinnitus and hearing complaints. And you see right away that the percentage of people having these issues in the highest group of the group with the highest burnout scores is significantly higher. We also evaluated this at the Thomas More University College on 253 subjects. And we looked at the ANL acceptable noise level test. That is a test that will evaluate how much noise you can expect during a conversation. And there we saw a very significant correlation with burnout signals. The same thing went for self-reported noise acceptance. So if you put it on the score yourself, how well you are in accepting noise, you see this correlates highly with burnout signals. The same for self-reported understanding speech and noise, and for auditory concentration. And finally, also tinnitus plays a role. Exactly the same conclusion as in the earlier studies from Hansen. Now, this is also related to the design of the office environment in which you are working. As you see here in a communication from the Harvard Business Review, the truth about open offices clearly indicate that open offices may be a pretty bad idea, definitely if they are large and there's a lot of people in them, to result in burnout when there are communication problems and hearing problems. Therefore, you may want to look into this. It's essential that people with hearing loss treat their hearing, so you get treated hearing loss. But on top of that, if that's done, you also take the design and the space into account to make communication easy and avoid unneeded exposure to sounds and noise. What about social isolation and loneliness? In otolaryngology, head and neck surgery, Shukla and others presented this study. In fact, people with hearing loss, particularly those who do not use hearing aids, show elevated levels of loneliness. The conclusions of this study is that their findings is that hearing loss is associated with loneliness and social isolation. And this, of course, can have significant implications for other aspects of cognitive and psychosocial health. And here's a fairly well-known publication in the Lancet Commissions, Dementia Prevention, Intervention and Care, the 220 report of the Lancet Commission. And here you see that there are 12 modifiable risk factors, and the bar in blue indicates hearing loss. So if you can treat hearing loss, you start to modify this aspect, and you will lower the risk of dementia 8.2%. It's the highest score of all modifiable risk factors, but you shouldn't wait too long. You should do it in midlife, which means don't wait until you're 80 before you start treating your hearing loss. Please do it in due time. And here you see the factors we have talked about: communication, social isolation, loneliness, employment burnout, depression, quality of life, psychosocial and cognitive health, and dementia. So now it's time to take action, because don't just accept that this will happen. There are many options available, and that's why the World Health Organization also has a very clear action plan. So the action plan has two fundamental layers. The first layer is prevention, and that is why WHO has the Make Listening Safe initiative and has created many standards and documents to support this. Ensure that people don't listen unsafe to devices and systems. So there's a standard for all your smartphones playing music. Make sure they measure weekly dose, they are safe, and you inform the users. Also, personal amplifiers need to be safe. It is fine to get some extra amplification, but do in a safe way, and it's the same logic as the standard for smart devices and systems. And then there's also a new standard on venues and events to ensure that hearing protection is available, that they use lower levels, and at that moment also there is monitoring in place. The second layer is screening, and there's a very interesting hearing screening handbook from WHO available. We will share the details at the end of this session, and we will also make sure that in the handout you will find a link. So hearing screening should be done for newborns and infants. That's in place in a lot of countries, but definitely not in all. There should be school-based hearing screening. And finally, and that is something which has to be worked on a lot also in Europe, is that from the age of 50 onwards, all adults should get their hearing screened. WHO has a very good tool. It's called the Hear WHO Screener. It's something an app that you can install on your smartphone. It's free of charge. It's already available in English and Spanish, but we see that Dutch and French is coming soon. So please go and check if it's available for your language, and please advise all to do this in an easy and early way. And then finally, of course, intervention. Intervention which should be timely and appropriate. So timely and appropriate hearing care, which can be surgery, which can be hearing aids, cochlear implants, which can be rehabilitation, availability of assistive technology, captioning, so many extra things. We shouldn't see this as a real cost. In fact, intervention is an investment. As you will see from the presentation later, investment in hearing care is very cost effective. You get a return on investment of more than 30 to 1. So for every euro you invest in hearing care, you will get a return of 30 euro at least back in Western Europe. It's also important that intervention is person-centered care, really listening to the needs and doing this with full involvement of the user to be sure to be effective and to be also sure that it's adopted in the right way. Now, let me give you a case story from Belgium. In Belgium, the National Institute for Health and Disability Insurance is creating and is launching a whole campaign on the 3rd of March this year. The tagline of the campaign is "Hearing loss is never normal." It's directed to first-line health workers towards general practitioners and others. And the important aspect is detect, notice the first signs of hearing loss, make it easy to discuss hearing problems with every patient, no matter the age, because we see too much in older age that hearing loss is deemed normal for the age. Hearing loss is never normal. Hearing loss leads to communication problems and all the aspects you have seen before. And then the third bullet point is, please refer. If you see there is a need for intervention, if you need there is a need for more assessment, please refer to the ENT specialists, to an audiologist and a hearing center, wherever, to be sure that hearing loss is evaluated and due intervention is identified in good cooperation with the general practitioner, of course. They have created a dedicated webpage where you can find all the information on the consequences of untreated hearing loss, where you can find why the role of the general practitioner is so important in identifying hearing loss and to talk about it, where you can see what are the early signs of hearing loss, where you can find red flag conditions that require more urgent referral, and where there's also a hearing screening questionnaire available with the interpretation that the GP can use in communication with the user. So this is what they will find on the website. There will be a video talking about the consequences of untreated hearing loss. There will be a link to the Hear WHO app so people can test and evaluate their hearing themselves. There will always be flyers available. So here you see a flyer talking about the impact on work. So did you know that untreated hearing loss increases the risk for burnout, unemployment, and early retirement? But of course, there's more. There's also another one talking about this important event, the World Hearing Day, 3rd of March. Hearing loss is never normal at any age. Facilitate to make it easy to discuss hearing loss, to anticipate the possible consequences for health and quality of life. So I hope this gave a quite good overview of that Belgian campaign. There are many aspects available, so please watch out for more information. You will find a lot of information in the World Report on Hearing. The link is here. Please go and check out the Hear WHO app. And there's also a very interesting new training manual available for first-line health workers, talking about the importance of detecting hearing loss, what you can do about it, and how you can refer in a very good way. All available at the WHO website. Please come and join the World Hearing Forum to help us promote quality hearing care and talk about it in a very good way. And I want to thank you for your attention, and please enjoy the rest of this lunch debate. Thank you so much.